You never think it's going to happen to you, until it does. It started on a freezing January morning in Chicago, the kind of cold that makes the air bite your skin. I was standing in my kitchen, waiting for my coffee to drip, scrolling through my phone, when a notification popped up. Your hospital bill is ready. I frowned. Hospital bill? I hadn't been admitted to a hospital. Not really. Just that one quick ER visit a few weeks back. A night of stomach pain, a few tests, and they sent me home before sunrise. I figured it was food poisoning or stress. Nothing major. But when I opened the email, my breath caught. The total was $7,142.80. I blinked at it, refreshed the page, looked again. It didn't change. I actually laughed, one of those awkward, disbelieving laughs that fade into silence. I had insurance. Pretty good insurance, I thought. Surely this was some mistake. But that number stared back like a threat. The coffee went cold on the counter. I didn't even make it to work that morning. I sat at the kitchen table, refreshing the page, reading every line. Emergency department facility charge, diagnostic imaging, professional services. My eyes glazed over. By noon, I called the billing department. A robotic voice put me on hold. 10 minutes, 20, 40. Then a person finally answered, only to tell me they couldn't help. You'll need to contact your insurance provider. So I did. And the insurance agent told me the physician who treated you was out of network. I blinked again. But the hospital was in network. Yes, but the emergency physicians operate under a different group. That was the moment I realized I had stepped into something much bigger than a clerical error. That night I lay awake replaying it all. I thought about the bills waiting to pile up, the rent due next week, the credit card that was already too high. I tried to tell myself it would get sorted out, that someone would fix it. But the truth is, I didn't know who someone was anymore. The next few days became a blur of calls, emails, and frustration. I started keeping notes in a little spiral notebook. Dates, names, claim numbers. I wasn't organized by nature, but fear makes you meticulous. One afternoon, after being transferred 6 times, I spoke with a woman who actually sounded sympathetic. You can file a claim appeal, she said, but it might take up to 90 days. 90 days. 3 months of waiting while interest grew and collectors circled. I asked, what am I supposed to do in the meantime? She sighed, you can always set up a payment plan. That night, I opened my laptop and typed how to dispute hospital bills. The results were endless. Articles, blogs, Reddit threads, all filled with people just like me. Stories of $9,000 stitches, $14,000 ambulance rides, $3,500 CT scans that insurance refused to cover. Somewhere between panic and exhaustion, I realized I wasn't alone. The next morning, I decided to treat this like a project at work. If bureaucracy was a battlefield, paperwork would be my armor. I gathered everything. ER summary, test results, the explanation of benefits, EOB, even the boring insurance pamphlet I'd thrown in a drawer months ago. I laid them out on the dining table like puzzle pieces. Then I saw it. The hospital's invoice listed a level 4 emergency visit, but the EOB said level 3. The difference? Roughly $1,200. So I called again. Hi, I said. I think there's a mismatch in the coding between your bill and the insurer's EOB. There was a pause, the kind where you know they're checking something important. Let me escalate that, the rep finally said. 2 days later, they called back. You're right. We've adjusted your account. Just like that, $1,200 vanished from the total. For the first time in weeks, I smiled. It wasn't victory exactly, more like a breath after drowning. That small win changed everything. I started combing through every line of the bill. There were charges for supplies, observation room, lab services. Some made sense, others didn't. I learned new vocabulary, CPT codes, HCPCS modifiers, EOB discrepancies. I spent my lunch breaks reading about billing audits and appeal rights. I never thought I'd care about such things, but desperation teaches you fast. Then I discovered something no one had mentioned. Hospitals can negotiate. I called the billing office again. Do you offer financial assistance or cash discounts? Yes, the woman replied cautiously, but you'll need to submit an application. When the envelope arrived, it was 5 pages long. They wanted pay stubs, tax returns, rent receipts. It felt like applying for a mortgage just to pay for being sick. But I filled it all out, scanned every document, and sent it back. 2 weeks later, I got the letter, approved for 40% reduction. I read it twice. My $7,142 bill dropped to $4,200. That night, I poured myself a glass of wine for the first time in weeks. It felt like winning a silent battle nobody else could see. Still, the journey wasn't over. I set up a payment plan, $250 a month, and made the first transfer. But the experience had changed me. I'd gone from panic to persistence, from being intimidated by paperwork to wielding it. Every month, as I paid another installment, I grew a little stronger, a little less afraid. I also started talking about it. At work, during lunch, someone would mention a medical bill, and I'd jump in. Did you ask for an itemized statement, I'd say. Did you check the CPT code? People looked surprised, sometimes grateful. One coworker saved nearly $1,000 after following my advice. But the more I talked, the more I realized how broken everything was. How most of us walk into hospitals thinking our insurance will save us, only to learn later that it's just a safety net with holes. The emotional toll was real. I remember one night sitting alone, staring at a pile of papers, bills, letters, reminders. The apartment was quiet, except for the hum of the fridge. For a moment, I felt so small. Like the system wasn't built for people. It was built for paperwork. I thought about calling my parents, but what would I say? That I was scared? That adulthood was nothing like I'd imagined? Instead, I just sat there, tracing the lines on the bills with my finger, promising myself that I'd get through it. And somehow, I did. Months later, I stumbled upon a Reddit post. Hospital charged me $9,000 for stitches. Help. I clicked instantly. The writer sounded terrified, desperate for guidance. I replied with everything I'd learned. Ask for an itemized bill. Compare it with your EOB. Dispute the codes if they don't match. Ask for discounts. Never pay before you understand. A week later, they messaged back. I followed your advice. They dropped it by half. You saved me. I read that message 3 times. My eyes watered a little. Somehow, my worst experience had become someone else's lifeline. It made all those hours on hold, all those sleepless nights feel like they had a purpose. A year passed before the final payment cleared. When I saw the balance hit 0, I expected celebration. Instead, I just sat there in the quiet of my apartment, staring at the screen, breathing slowly. No confetti, no fireworks, just stillness and the strange relief of something finally ending. That night, I made tea instead of coffee. I turned off my phone, closed every tab on the laptop, and just listened to the city hum outside my window. For the first time in months, there was no dread sitting in my chest. The next morning, I opened my notebook, the same one filled with names, dates, and call logs, and wrote in the last empty space, paid in full. Then I closed it for good. It wasn't just a notebook, it was proof that I'd survived something I hadn't been prepared for. But survival leaves marks. Long after the payment stopped, I still flinched whenever an envelope from the hospital arrived. Even when it was just a survey or a newsletter, I'd feel that flicker of panic. It took months to unlearn the reflex of fear. I started thinking a lot about the system that created this fear. How we live in one of the most advanced countries on earth and still treat health like a luxury purchase. I wasn't angry anymore. I was curious. I wanted to understand why. So I began reading about billing transparency laws, about insurance contracts, about how hospitals calculate chargemaster rates. It was like lifting the curtain on a play I'd been acting in without knowing the script. I realized most patients never see these numbers until it's too late. They don't know that hospitals set sticker prices far above what insurance ever pays, expecting negotiations, and when those negotiations fail, the leftover falls on us. I learned that my $7,000 bill had started as nearly $13,000 before the discounts. That realization hit harder than the bill itself. Some nights I'd walk around the neighborhood just to clear my head. There's a little diner on the corner that stays open all night, the kind where the coffee's burnt but the staff know your name. I'd sit by the window with a notebook, scribbling thoughts about how we treat people when they're vulnerable. Because that's what this really was, vulnerability. Being sick, even for a night, made me human in a way I hadn't felt before. Before that, I thought adulthood meant independence, earning your way, paying your rent, managing your time. But the hospital taught me that independence has limits. Sometimes you need help. Sometimes you have to ask questions even when you're scared. And sometimes asking is the bravest thing you can do. A few months after everything ended, I started volunteering with a local community clinic. Nothing major, just helping patients fill out forms or understand their EOBs. The first day, an older woman came in holding a crumpled envelope. She didn't know what half the words meant. She kept apologizing for not understanding. I told her, "Don't apologize. The paperwork's supposed to be confusing. That's how they get you." She laughed softly, like she needed permission to stop blaming herself. Every week I met more people like her. People who worked 2 jobs, people who spoke little English, people terrified of one bad day. Their stories mirrored mine, only heavier. And yet every time I explained how to request an itemized bill or how to appeal a charge, I felt something heal inside me. It's strange how helping others can fix the parts of you that still ache. Then came a small turning point I didn't expect. A journalist friend heard about what I'd gone through and asked if I'd talk on record for an article about medical debt. At first I hesitated. The idea of my story out there, attached to my name, made me uneasy. But then I thought about all the anonymous posts and strangers who had unknowingly guided me when I was lost. Maybe it was my turn to return the favor. So I said yes. We met at a cafe downtown. She recorded our conversation on her phone, asking gentle questions. How did it start? What surprised you the most? What did you learn? When the article came out a few weeks later, my story was just one among dozens, but it resonated. People began messaging me, friends, coworkers, even strangers, sharing their own versions of the same nightmare. That's when it really sank in. I wasn't unlucky. I was part of a pattern. One message stayed with me. It was from a man in Arizona who wrote, "I listened to your interview while paying my 3rd hospital bill. For the first time, I didn't feel stupid for not understanding it." That single line made every hour on hold worth it. It's easy to think stories don't matter, but they do. Stories remind us that systems are made of people, and people can change things. So I started telling mine more often, at local events, at my workplace, even online. Not as a rant, but as a reminder. If you ever find yourself facing a bill that doesn't make sense, don't freeze. Don't assume it's final. Ask, question, challenge it. because silence costs more than any fee on that page. Time softened the edges of those memories. Now, when I think about that cold morning in Chicago, it doesn't make my chest tighten. Instead, it feels like the beginning of something. An education I never asked for but desperately needed. An expensive education, sure, but one that changed the way I see value, fairness, and resilience. Sometimes I'll catch a hospital drama on TV, and when the doctor says, "We're doing everything we can," I smile a little. Because I know there's another side to that line. The paperwork, the coding, the people on hold for hours just trying to understand what those words will cost. It's not cynicism anymore, it's awareness. And awareness is power. A few months ago, I got another hospital bill, but this time it was for my dad. He'd slipped on ice, fractured his wrist, and ended up in the ER. When I saw the envelope, my stomach clenched out of habit. But then I smiled, because I knew what to do now. I called the billing office, verified the provider network, requested an itemized bill before they even asked for payment. When a code didn't match, I caught it on the first read. By the end of the week, the total had dropped by almost $1,000. Dad looked at me like I'd performed magic. I told him, "It's not magic, it's paperwork." We both laughed. That laughter felt like closure. These days, I keep a copy of my old notebook on a shelf, not as a trophy, but as a reminder. Every messy note, every crossed-out number, every exclamation mark written in frustration, it's proof of endurance. It reminds me that behind every big institution are people who can be persuaded, challenged, reasoned with, and that sometimes persistence is louder than any complaint. There's a quote I keep pinned to my wall now. Courage doesn't always roar. Sometimes it's the quiet voice at the end of the day saying, "I will try again tomorrow." That voice carried me through every phone call, every denial letter, every night of doubt, and maybe it can carry someone else too. When I started telling this story, I thought it was about money. Now I see it's about something deeper. Trust. Trust in the system, trust in ourselves, trust that fairness still exists somewhere. Losing that trust hurt, but rebuilding it taught me how strong we really are when we refuse to accept confusion as normal. If I could speak to the person I was on that cold January morning, I'd tell them, "You're going to learn more than you ever wanted to, but you'll be okay." Because sometimes the worst experiences become the clearest mirrors. So, if you're listening to this right now, maybe staring at a bill you don't understand, take a deep breath. You're not alone. Start small. Ask for explanations. Write things down. Be patient but persistent. You deserve clarity. And if anyone ever tells you it's hopeless, remember my story. Remember that persistence, a notebook, and a few late-night cups of coffee can move mountains. When I close this chapter, I'm not bitter anymore. I'm grateful for the lessons, the empathy, and the strange peace that comes after chaos. Because through all of it, I found something no bill could take. Confidence. Now, whenever someone brings up medical bills, I don't flinch. I smile, sip my coffee, and say, "Let me tell you a story." Thanks for listening. If this story helped you feel seen, share it with someone who might need it. And if you want more real-life stories that make sense of the chaos around us, hit subscribe to Fictional Frame, where every story has a lesson worth living.